It was very interesting. At the beginning of our work with the Ministry of Health in Malaysia, Malaysia did not have access at all to affordable treatment for hepatitis C. We were talking about the cost of treatment was around 300,000 ringgit. So that's the price of a flat. That's what you needed to pay if you wanted to be treated. Over the years, starting from a clinical trial with us, we have been able to build with the Ministry of Health in a very organic way, a real access strategy for Malaysia. A strategy that involves local production, a strategy that involves awareness raising among the general public, a strategy that involves test and treat, working in collaboration with another organization called FINE. So we started with a clinical trial, and as time went on, we put more and more ideas and partners in the basket. And that has really turned into an access strategy, which makes Malaysia today definitely a trailblazer, because we have here now in Malaysia one of the cheapest DAAs among middle-income countries. And that's really unique, it's remarkable, and it's something to be really proud of. You know, we are at a time now just in the COVID-19 crisis where we see the importance of having a strong public health system. So I think for me it's very obvious, but I've always been someone who believes that health is a common good. Health is not a merchandise like any other, and we need to have a strong public sector if we want to have a strong country. And again, you know, this response to the COVID-19 crisis is a really, really good example of why it is so important. So it's been slow, it's been a slow start, and it is always. We're talking about changing habits, changing way of working, adapting to a new environment for a Ministry of Health. So it is something that takes time. You have to convince people, you have to change guidelines, there's a lot of things to do. But what I can see is now everything is being almost put in place for hepatitis C to be treated in a more effective, decentralized manner in Malaysia. So I think we will catch up quickly on treating most of Malaysians or all of Malaysians that have hepatitis C. So I believe that elimination by 2030 for Malaysia is definitely a target, an objective that can be met, and it's possible. We have the tools in hand to do that.